welcome to our video podcast on a very relevant topic that is being deliberated upon in public health circles, especially zoonosis, which has come under the spotlight post the COVID-19 pandemic. We have with us today Dr. Ricardo Soares Magalhaes, who is a veterinarian and associate professor of population health and biosecurity and director of the Queensland Alliance for One Health Sciences at the University of Queensland in Australia. He is an internationally recognized leader in the spatial epidemiology of zoonosis and emerging infectious diseases with over 200 lifetime peer-reviewed articles. He's been an international expert and consultant to the World Health Organization, the Food and Agriculture Organization, and national governments in Asia and Southeast Asia on the development of spatial decision tools to enhance the surveillance of zoonotic influenza. Since 2008, his team has supported the development of the first integrated empirical studies in China, Vietnam, and Bangladesh that have led to impactful changes in surveillance policy for zoonotic influenzas. Today he talks to the Infectious Hazard Management team at the WHO Southeast Asia Region Office on the importance of having integrated zoonotic influenza surveillance and a first-ever initiative called ZIDAR that is being piloted in Nepal in partnership with WHO CRO.
Hi, my name is Ricardo Soares Magalhaes. I'm Associate Professor of Population Health and Biosecurity at the Queensland Alliance for One Health Sciences at the University of Queensland. So I'll be talking to you about the importance of integrated zoonotic influenza surveillance and the importance of the One Health approach to tackle the interface of transmission between animals and humans in the context of influenza.
We could start with you were telling us a bit about what is zoonotic influenza surveillance and why is it important for the Southeast Asia region?
So influenzas, they are a group of viruses that have an important sort of burden of infection in human beings. There's a particular group of these infections, of influenza viruses, that derive directly from animals. And these are called the influenza A, and that's what we call the zoonotic influenza. They tend to be harbored or maintained quite effectively within the animal population, and then spill over to the human population as a result of the occupational exposures of individuals, and also through the consumers, those that visit, for example, live animal markets, or are engaged in the production of poultry and even swine species.
What are the current challenges that you see in terms of performing integrated zoonotic influenza surveillance, especially to the region?
Well, there's a couple of points that make the control and prevention of these infections quite challenging in the region of Southeast Asia. The first point is that animal species and rearing animal species is quite ubiquitous. So the majority of the population owns some sort of livestock species, including poultry and swine, which increases the chances of exposure to these viruses. Given the size and the magnitude of the production of livestock amongst the countries, it is quite challenging to understand the distribution and the dynamic transmission of these viruses within those populations. The other challenges are around the ability to link information across human and animal health. Most countries have very mature and well-developed surveillance systems in the human side, but that's not the case, particularly in the animal health system. They tend to be poorly resourced compared to the human population sort of surveillance systems, and that becomes a bit of a challenge as well. One last point is that for us to have a complete picture of the transmission of these zoonotic influenzas across the three sectors, we need to have a combined approach to the detection and monitoring of these viruses. And at the moment, there isn't a really clear guideline on how to do that. So that becomes quite challenging in the way that we would like to see things moving on in the future in this space.
This is a very very interesting partnership under your leadership between the WHO Southeast Asia Region Office and the University of Queensland. Could you tell us something about how you plan to improve the integrated approach to surveillance and preparedness of zoonotic influenza?
Indeed, we have a very exciting pilot project currently ongoing in partnership with as you say, the regional office of Southeast Asia. And the first country who's trialing this pilot is the country of Nepal. We are developing a surveillance geospatial system that allows us to identify which communities are much more vulnerable to the spillover events of these zoonotic influenza viruses. When I mention vulnerable, is it about the likelihood where these events can occur, both in the animal population, which we call the system for the animal health, and then using that information to infer which human communities are at greater risk of observing these spillover events, and potentially some of them can cause the next pandemic. So it's a geospatial system that we call Zoonotic Influenza Distribution Assessment and Ranking, or in short called ZIDAR. It's a bit of a pun on radar. It's to keep a check on which areas are indeed the ones that we should be looking at in more detail, and perhaps deploy those limited resources that countries have to allocate the proper surveillance that is integrated across the two sectors.
Could you give us a little more information around this approach that you're using, ZIDAR, and how this technical product will support CRO, member states, to be better prepared for any future zoonotic influenza?
So the ZIDAR approach involves two stages. Two of those stages, they are consultation stages. The first one, we carry out a stakeholder workshop with a duration of about a day and a half, where we bring together around the same room representatives and experts from human influenza as well as animal influenza and experts from the environment. So this approach allows a discussion around what type of databases we should be considering for the country, also validating existing data that WHO already has available. That's as a first point of call. The second point of call is then the identification of what we call the zoonotic influenza transmission interfaces. So what are the settings in animals and in humans where these transmissions will be happening? And so there is a discussion around the context within the country where the transmission of zoonotic influenza will occur or are more likely to occur, but also followed by a discussion around what risk factors usually these interfaces will carry to perpetuate and sustain the transmission. Once the interfaces are identified and the risk factors are outlined, this is followed by the last stage of the consultation, which involves the ranking of the interfaces. So, for example, if a country considers initially a total of 7 interfaces in the animal health and 2 interfaces in the human health, now it's time to rank them, which ones are more important in that context. We do the same for the risk factors, and that concludes the first stakeholder engagement. The second part involves a technical support. We go to the University of Queensland and the Special Epidemiology Laboratory, develop the model based on that initial consultation, and then we go back to the experts and show the model structure. We have a discussion around whether the model is doing the right thing doing some expert validation of the results. This is then followed by capacity building. So the key outcome of this last engagement is to provide the technical support so that the country and the different technical teams in the animal health and human health can utilize and run the models by themselves. So the model code is run on open source software, and it is our intention that the countries are independently running the simulations after our team leaves. So that's a really important outcome for the long-term sustainability of this tool as a decision support tool to guide surveillance at the human-animal interface.
Any examples from the rest of the world that we can probably learn from in the region, given our unique situations and circumstances?
In the context of influenza, I can't give you any. This is pretty much the first time we're trying to develop a geospatial system that aggregates data across sectors in consultation with the experts, the local experts. So in the context of influenza, I can't find an example, but indeed there has been some work, very good work around rabies and the integrated surveillance for the control of rabies, in particular areas that are concerned about elimination in 2020. So the countries like China, they have an integrated approach to the control in the large hotspot areas where human data are combined with animal dog bite data and also the vaccine information that comes through the vaccine teams of canids, and that information is used to then make decisions more locally on whether strengthening or sustaining the public health interventions that usually are around post-exposure prophylaxis of human beings. So that would be perhaps the most mature example I can give you at the moment of such an approach that is quite targeted and risk-based.
So I think in conclusion, how do you ideally see this panning out in an ideal scenario? How many years it would take for results to show? I mean, in terms of your expectations, if you could just summarize that could be like the concluding.
The ZIDAR project will come to an end in March. It is a pilot. We're testing it in a single country. The idea is to build the foundations of the geospatial model that will allow the identification of animal populations, livestock populations where spillovers are more likely to occur, and then ZIDAR-H, which is the model for locations where the human exposure for spillovers from the animals can occur. So we're hoping that by March we will have our preliminary results for the model that we are now testing in Nepal, and it is our expectation that other countries in the region will adopt this approach to identify those communities where the zoonotic disease, zoonotic influenza surveillance in an integrated manner could be deployed and into the future. So we're very hopeful that the results from March will then be picked up by other countries in the region, and ZIDAR becomes sort of a global tool to guide the surveillance efforts for zoonotic influenza.